Today I'm talking jowls. I saw 8 people in my clinic last week for jowls. What's fascinating to me is anything from 30 to 60 plus. And sometimes the 30-year-old has more of a jowl than the plus 60. And I'll explain why that is today. I'm going to give you my #1 treatment that I consistently do in clinic and that is now actually FDA approved. We're going to go through what the jowl is, what you can do about it. Now I know you want the most cost-effective, longest lasting, most holistic treatment with minimal downtime and no surgery. So that's exactly where we're going with the conversation today. And this is something I've been doing for years, but it's just gaining popularity now, and I'll explain that to you as well. Why would that be just now when we've known about it for a long time? Let's dive in. So the first thing we need to understand is what is a jowl. And most people are referring to that little notch just behind the chin area where it looks like the face is falling down and sagging. That's what my patients describe to me. What's really happening, some of the fat grows or hypertrophies, some of it shrinks, so it makes the hollow look even worse. Now here's what people don't think or don't realize to think. There's bone involved. So if you talk to the dentist, the mandible loses size over time. So we need to think about that. There's muscle that's pulling down. That's why people say, well, I'll just Botox the muscle there. It will lift it all up. Not so fast, as I'll explain. So here's an example here. See how the fat is sandwiched between the muscle. Imagine that fat being gone. Now the muscle has no support. So just Botoxing or slowing the muscle movement down that you might think will help and be effective inexpensively, while it can work for a while, once this fat pad has gone to a certain level, it just won't work. So Botox can work, but it's short-lived, and if it's advanced, it will not work, and that's exactly why. And of course we have skin. So as skin sags, there's something called the mandibular ligament here. As that relaxes, the skin sags, fat grows and shrinks, and then the bone loses shape and loses volume. That all leads. So it's so complex. It's much more than just putting Botox there, but let's go into the treatments. The treatments are going to make much more sense when you understand why would a 32-year-old have the jowl of a 60-year-old. Now I'm throwing out numbers of age here. In my clinic, I don't even ask people their age. I can tell skin age, bone age, and what needs to be done. The only reason I really want to know is hormones and a little bit of genetics. But in general, I'm throwing out, you get the point. Why would a young person have the jowl of an older person? Well, you have to understand 3 things. And these 3 points are what really you need to take away from this video if you want to prevent, if you never want to have a treatment, or you want to reverse some jowls without any surgery or injections. And #1, that is the fat pads. So sun exposure is one of the top things that you can control to keep your fat pads. So sun exposure is going to kill the fat, and it's going to cause more sag, and therefore you're going to get a jowl at a much younger age than what you would want to be. #2, think of nutraceuticals. Now, before we even talk nutraceuticals, it's your food and your food supply, because remember I said bone plays such a role. Bone comes from what? Vitamin D, calcium. We want to get calcium into the bone, not into the heart. Think vitamin K2, D3, think collagen powder, think eating real food. So without hormones, why? A lot of our food and food supply has something called xenoestrogens. And these mimic estrogens, and they mess with the hormones, and hormones play a big role in bone and fat, and also the muscle, because when we lose the fat, the muscle has nothing to hold on to or support, and so that leads to sag. So nutraceuticals, exercise, and I have videos on the #1 exercise. You can do it in as little as 15 minutes 3 times a week if you're doing the right exercise for your bone and your fat. And #3, the overall weight of the body. So there are easy faces to treat, like this one, and there's difficult faces to treat that are more full, like this one, and then we don't have gain for lift because there's too much fat in the face. I'll tell you a story. Someone that I saw about a month ago now, I had seen her 6 months prior, and she's about 42, there was significant jowls and fat pad sag. And I said, she said, I think I'm gonna lose about 30 pounds anyway, so just treat me with that in mind. I said, no, you come back, I'm gonna give you 6 months. Let's see what you can do in reducing your weight. Literally 3.5 months later, she comes back. She lost about 10 to 15 pounds and exercise, and that's what prevented the sag. She needed a fraction of the treatment she needed if she didn't lose the weight. So understand, face fat, body fat, insulin resistance, hormones, it all plays a role in the jowl. So understanding that, now let's go to the different stages. There's 4 stages. We'll go through the treatments that I use for each. So stage 1, that's minimal jowls, minimal sag. And understand, a thinner face is going to be easier for me to treat than a fuller face with more fat, because I can actually add volume and get some lift. But the treatment in stage 1 is, if you want the most natural, which most people do, is going to be RF microneedling, where we use microneedling to kill the fat and tighten the skin. Stage 2 is going to be more significant sag, and here is my #1 treatment that I'm doing for almost all of my clients, and that is something called Sculptra. And Sculptra, but it's not just using Sculptra, but it's this pattern, and FDA approval just came for the preauricular, and it showed that when the preauricular is treated, you get tightening of the jawline. Now, the FDA approval did not include injections at the jawline, which are a must. So I treat the back of the jawline, the angle, the gonial angle, the preauricular area, that pulls everything forward, but you need this single injection point, and that's anterior to the jowl, and that's away from the facial arteries, so it's a safer injection. But that, along the bone, mimics the bone and straightens the jawline out. So remember, Sculptra adds volume, but it also tightens skin, and it's FDA approved now for glow. So it's perfect for this quarter of the face, gives a pullback. And remember, stage 3, more significant jowls, you can combine these by doing RF microneedling to remove the fat, tighten the skin, and then adding your Sculptra as needed. Remember, you're all worried about RF microneedling. All great devices can harm the face. I use it to get rid of face fat in the lower face, and it does tighten skin. We use different layers, different heat, different duration of heat for every different face. Now, #4, if you have significant sag, you typically then have facial sag. We're now talking surgery and a facelift. So those are 4 treatments for 4 stages. It's what I do in my clinic. But by far, the #1 thing I'm doing is biostimulators to pull. You're now gonna wanna watch this video all about Plasma Sculpt, and one down here of me getting my plasma fill injections, which are great options to help lift, tighten, and give you glow. Stay tuned here. Keep your skin and body beautiful, healthy, and vibrant.